Hi, everyone. We're back. It's Alexandra and Sydney. So happy to have her here with me again for this second part of our facial series. We're talking about facial contouring, and we're going to talk about what the facial fat reduction options are with our gorgeous MDPen device, which you see there next to Sydney. So she'll be kind of holding hand pieces as we speak about them. Please feel free to ask questions in the comments. I know this has been a really hot topic. We did our Snatch Jawline webinar last November that was really successful. And I know people still care a lot about these options that are out there, and they're painless. So we're going to go through these. Again, please participate in the comments. I do have a shopping code there for you guys. It's Contour13. You can use this in our retail store and save some money. So basically, when we're born, our faces are more in a heart shape, so to speak. And as we age, we develop what those of us in the industry sometimes refer to as that inverted triangle. So where the base of the triangle is larger and then the top being more pointy. So certain things can happen to our faces. The temples can hollow, where we get what some people will call a peanut head. It sounds horrible to say, but that's when you see people filling in the temples with injectables that can be safe for that area. Now, also, of course, as we get this inverted triangle, the fat tends to gravitate at the lower face. So this is where you see the jawline changing, you see jowls forming and things like this. With that being said, some people genetically just have a turkey neck. It doesn't matter if they're skinny, overweight, whatever. Some people have that, little bit of extra tissue or fluff right there under their chin. So this is totally an option for them or an option for you if you are watching this. If you don't want to undergo the injectable treatments on the market where you're puffed up like a toad for up to 6 weeks, this is an option for you. If you want RF contour pieces that can be used at even like the time of a facial, this is for you. But we're going to get through each of these 3 hand pieces. We really want to focus on Sydney, if you want to show, I think you have the small there. We talked about the small and mini last week. So here you have that small shaper. And this can be definitely used as part of the contouring, especially if you're just someone who's looking to have your cheekbones a little bit more defined. This is a safe treatment you can do once a week. There is no numbing required. You do want to keep the skin nice and slick. This is not done on dry skin. So you would either use like an ultrasound jelly. Sydney has the professional 16 ounce there. That's what I recommend having if you are a professional. We also do have the 3.4 ounce size. This is very nice for retail. So by using the gel versus ultrasound jelly, it's a little bit more elegant for your patient. And again, if you've already done a facial anyway, why not just keep that gel on the skin and use the shaper handpiece there? So there are preheating passes, therapeutic passes. We teach all of this with MDPen. When you do buy this device, you have a formalized training. We're not super close up to the screen today, but I know you can go back and see it from last week. Sydney showed those really nice pre-settings. Super user friendly. It'll show you the exact area of the face. It'll tell you which handpiece you're on, and you can definitely go and adjust it from there. This is that direct link for the growth factor gel, guys, just so you have it. So getting back to the contouring as well, you do have the mini shaper handpiece, which is going to be a little bit different. And this one you can see actual like electrodes on it. Very small. Yes, the mini shaper is right there, guys. So much smaller than the regular shaper. This is intended for the face. This is really going to get in those small, hard to reach area all around the cheeks, the neck, the submental. You can see Sydney there. And you're just doing like really small little circles. It's something that's easy to learn. It's safe. It kind of feels like a hot stone massage. Really nice. And ideally, you would do 8 treatments. You would do 1 a week for the first month, and then you could do them 2 weeks apart, or you could just do all 8 at once a week over 2 months, whatever best fits your schedule. Now, when it comes to actual fat reduction, we do want to get into talking about the intensive. And this is going to be the RF microneedling handpiece. Many of you may already be familiar with. And this is what's actually going to help with that deep tissue tightening fat reduction option. So that's the intensive there, guys. The gold needles are at the top in the cartridge. This is a single needle use. If you were doing this with the mini handpiece, you would go ahead and do that one first, and then you would do the intensive. You would numb your patient for this one, and again, get this right under the chin area. If you do have that submental fat, there's really impressive before and after photos. So Sydney has that right there. I don't see any questions coming in, guys. Feel free to ask questions. We're happy to answer them. This device is different from regular microneedling. It's going to be more of like a single stamp use with about a 20% overlap, ideally. So you're not doing typical tracing and things like that that you would with the pen. And this is going to be a lot more comfortable than other devices on the market. These needles are non-insulated and tapered. So you have that maximum energy, not treating all the skin along the needle, but treating where it needs to as well at the bottom of the needle, where you're deep down near the dermis, where you want to get, you're at that sub-Q fat layer, and you can start treating and melting fat that way. So these are the hand pieces. Sydney, I want to let you obviously talk about what you've seen people requesting as far as facial fat reduction options. I do have a question actually coming in right now. It's really the topic of the video. Hi, Alex and Sydney. Are there non-surgical fat reduction options available? Yes, there are. Let's answer this one.
Go ahead.
This one is, what role does diet and exercise play in fat reduction? Well, obviously, some people can lose weight in their faces very quickly. Some people, it's the first place they gain. Some people are always puffy in the face from allergies and things like this. Of course, you want your patients to be as healthy as possible. You're seeing more med spas on the market that are wellness treating as well. So it's always important to have healthy discussions with your clients, but always the best time to use any type of medical non-invasive treating device is when you have stubborn fat. So this is fat that is not going away with diet and exercise. So I hope that answers it short and sweet there. Next question, I'll let you get this one, Sydney. Are the results of facial fat reduction permanent?
Yeah, that's a great question. So just like with aesthetics, you do want to upkeep what you have corrected. That's probably the best way that I can explain it. So as Alex mentioned, these treatments, if you are doing the shapers, you're seeing treatments in sessions anywhere from 8 to 12. Once a client gets to their desired end goal and they are happy with their results as they went through a whole series of sessions, at that point, we like to put people in maintenance mode. So that just simply means, they aren't coming as often, but they are still coming to get these treatments periodically throughout the year to upkeep and uphold the results that they have achieved. Because of course, gravity is still going to take place. Outside extremities, sunlight, pollution, UV rays, all will play a part in that loss of elasticity and the fat deposits in certain areas. So I would say you do want to upkeep it. You do want to keep your results, and that's probably the best way I can explain it.
Definitely. We're always racing the clock, especially when it's a anti-aging concern. And again, you're fighting the inverted triangle, which we talked about. One great thing though with these treatments is after you have completed that series, which Sydney said with Mini Shaper can be, 8 to 12 sessions, sometimes 8 to 12 weeks. And then with intensive being like a series of 2 to 3, if you've done the RF microneedling, that collagen does keep remodeling and growing over those next 6 months. So you do not have to do maintenance within those first 6 months after you've completed the series. After 6 months, hopefully you're already seeing your professional regularly anyway. But take those new set of before and after photos and you can really see where you're at and then map out that maintenance schedule, maintenance routine, which won't be anywhere near what you had to do for the initial series. But yeah, Sydney answered that perfectly. We have another question here. Hey ladies, what are some common areas of the face where people tend to accumulate excess fat? So yes, it's definitely the lower face. It's the jowls. Some people, when they do gain weight, they lose their cheekbones if they did have visible cheekbones. And then also, of course, under the chin, where you get complaints about, turkey neck, double chin, things like this. So those are going to be the main areas. Absolutely. So when you need a treatment that is affordable, painless, non-surgical, this is going to be your go-to. We have actually extended our previous Labor Day sale for those of you that are professionals. So when you buy the MDPen system, hopefully with either the intensive RF microneedling or the fractional skin resurfacing handpiece, you are able to select one of your other handpieces for free. Get in touch with MDPen if this interests you. It's a really great deal. And if you strictly treat facial aesthetics within your spa, you may want to go with, the piece Sydney was holding, the Mini Shaper, as your secondary handpiece. And you're going to have what you need to treat pretty much every topic we're discussing during this contour series. And again, this can be used during facials. This can be used before an injectable appointment. This is a quick lunchtime, no numbing, painless treatment. Seeing if I'm missing any questions here, guys. Hope this has been helpful. We are going to have a third part of the contour series coming up next Wednesday. So I hope you guys can be there. If you missed last week, we did talk about facial stacking with these RF handpieces as well. So definitely check that out. Thank you so much for being here, Sydney, and being able to go into the official MDPen office today and show off those handpieces. We really appreciate it. And yeah, guys, just get in touch with MDPen if you have any more questions about these treatments. We'll have a product specialist happy to help you guys. Thank you guys so much. Thank you, Sydney.
Of course. Bye.
Bye.